Okay, I already talked about sex and disabilities, and a psychotherapist talked to me or responded to the video in which I talked about this, and he brought some important points, and I want to go over them. So, when we talk about disability, we often focus on mobility, access, or medical care, medical conditions that disable people. But one of the most consistently overlooked areas is actually sexuality. Many people with physical disabilities, emotional disabilities, social and emotional skill deficits, as he pointed out, struggle to access safe, affirming, and consensual sexual experiences. And for some, working with a sex worker, a surrogate partner, or an intimacy professional can be an essential part of their sexual health and overall well being. And I would like for everybody to have compassion about this. So, for individuals with mobility limitations like paralysis, chronic illness, or neurodegenerative conditions, sexual expression can be complicated. And not because of lack of desire, but because of physical barriers, caregiver oversight, or a lack of partners who understand their unique needs. And sex workers and surrogate partners can provide adaptive, accessible sexual and intimate experiences. They can help provide pleasure safely, and they can learn what their body can do, adapt positions or techniques that work with their specific physical abilities. They can also offer something many disabled people are denied, which is full adult sexual agency. These sessions can affirm personhood, dignity, and the basic human right of experience of pleasure and intimacy. Think about that. If you were in that position, would you want to have access to these things? For individuals with trauma histories, also anxiety disorders, developmental trauma, or emotional regulation challenges, intimacy can feel threatening and very overwhelming. And it's not easy to access sexual or intimate experiences. So, sexual professionals can create a highly consent focused, trauma informed space. They can move slowly, reinforce boundaries, and help their clients still stay grounded in their bodies, experience sexual touch safely, predictably, and in a way in which it's emotionally regulated. For many, this becomes a corrective emotional experience, helping them learn safe arousal, healthy touch, to trust their own bodies, sometimes for the first time. So there's a lot of benefits to this. In individuals, for instance, with autism, ADHD, social anxiety, intellectual disabilities, within appropriate consent frameworks, of course, anyone with limited relational experience also may struggle with the building blocks of intimacy, and professionals can help clients practice relational skills in a structured way, and in things like reading nonverbal cues, maintaining eye contact, negotiating boundaries, negotiating consent, regulating emotions during intimacy. And these are skills that people sometimes have never learned, and you learn by practicing them. And you can practice them with a professional that can help improve confidence and improve the prospects of future relationships. Anyway, disability is very complex, and the people who suffer from these disabilities are the ones in the brunt of this. And we cannot pretend like we understand, but shame is not helping. Shame is not conducive to their achievement of emotional and sexual intimacy. So sometimes a sex professional can be an ally in helping them explore their identity as sexual beings. Of course, there's ethical considerations to this. we'll talk about that in a different video. But for now, I just want you to be more compassionate and look at this from a different lens, from the lens of the person who is undergoing these challenges. And do not judge.